Module 2, Positive Behaviour Support. Learning objectives. Understand and identify different reasons for challenging behaviours. Understand types of problematic behaviours exhibited by children with ASD. Understand key steps to implementing positive behaviour support intervention. Problematic behaviours shown by children with ASD include repetitive behaviours, hand flapping, rocking, restrictive routines, and echolalia, disruptive behaviours, self-injury, aggressions, tantrums, and emotional control. Positive behaviour support strategies are known to significantly decrease interfering behaviours and increase appropriate behaviours exhibited by children with ASD. Positive behaviour support is used to influence and support appropriate behaviours through the adjustment of factors that may trigger or reinforce challenging behaviours. Positive behaviour support is a three-tier model in which the interventions become more individualised and intensive as they progress through the levels. Tier 1. Identify the behaviour that you would like to stop. Aim to prevent challenging behaviours from occurring through the use of adjusting the environment, activities, and other interactions that may aggravate interfering behaviours. This follows the understanding that challenging behaviours occur for a reason, including a personal or environmental reason. Some common reasons for challenging behaviours include to gain attention, to escape something or someone, to request something or someone, to meet a sensory need, or to express feelings. Tier 2. Identify what may trigger these behaviours. If behaviours are still present after adjusting the environment and activities that may cause challenging behaviours, we need to specifically identify these triggers. The trigger for these behaviours is known as the antecedent. Antecedents may be people, places, smells, noises, or changes in the environment that trigger challenging behaviours in children with ASD. The Motivation Assessment Scale is a questionnaire that can be found on Google that can help assist you to identify the antecedent. Consequence. Once the antecedent has been identified, you need to identify the consequence. The consequence is what the child is gaining from performing the challenging behaviour. So once the child performs the challenging behaviour, they may get to leave the room, gain attention, meet a sensory need, express their emotions without communicating verbally, or communicating their distress. Now that we know the antecedent or the trigger and the consequence or the benefit, we can replace these behaviours. First, the behaviours you want to replace the challenging behaviours need to be identified. By understanding the antecedent and the consequence, we can then eliminate the challenging behaviours by teaching new skills for communication or implement assistive strategies for expressing emotions in the antecedent situations. Provide strategies to meet sensory needs or environmental adaptations, changing the environment around the child, including other peers, smells, noise, or bright lights. When 1 and 2 don't make any changes and behaviours are still problematic and not improved, the child may need a behavioural intervention plan to be developed on an individualised level from a behavioural specialist or occupational therapist. Key points from positive behaviour support include problematic behaviours shown by children with ASD are repetitive and disruptive. Positive behaviour support can significantly change these behaviours. Steps to managing positive behavior change include identify the behavior you want to stop, identify the antecedent, identify the consequence, and identify the behaviors you want to start to replace the difficult behavior. What new skills can you teach the child? Positive behavior support.